our great honor to have with us James Clyburn, the Democratic Majority Whip from the great state of South Carolina, and recently appointed by Speaker Pelosi to chair the House Select Committee on the coronavirus. Uh, Congressman Clyburn, it's such a great honor to have you, a proud graduate of South Carolina State University. You've done a tremendous job over the last couple of weeks in guiding us and leading us through this crisis. There's one big question on the mind of most Americans today, and that is America ready to reopen its doors and its businesses?
Well, thank you very much for having me. It's a great honor to participate with another HBCU. As you know, I have 7 of them in my congressional district, and I'm a very proud graduate, as you said, of South Carolina State. And so I'm pleased to be a part of this and named in honor of a writer who I respect greatly, Colbert King and his wife. So thank you for having me. As for your question, I do believe that Americans are ready to go back to work. However, I do not believe that America is prepared for Americans to come back to work. The fact of the matter is, we know what is necessary in order to create a safer, not entirely safe, but a safer environment for people to work and play in. What we need to do is to make sure that we ratchet up the resources that are necessary to accomplish that. For instance, we've got, 360 million people in the country, and we've only had less than 3 million tests. That's less than 1%. We need to get to the proper number of tests that have been that's required according to the scientists. And so we need to have a surge in testing. That surge has not taken place yet. That's one of the reasons I have been crying out for us to go to mobile units to do testing so that we can test in rural communities where we do not have the transportation for them to come in to the testing sites, where we can test in remote communities. And all remote communities are not rural. I know of remote communities in New York City, the center of this pandemic. On yesterday, we had a director of a community health center in Queens, New York, and the president or the head of SUNY Hospital there in New York on a conference call with our whip office, doing our whip meeting. And they all talk about how remote some of the areas are and why testing is not taking place in these areas. So until we do that, we cannot design a proper method to get people back to work, get back to what's going to be a new normal. Won't be the old normal. We will be in a new place for a long time to come. And we've got to be prepared for the next pandemic. All of the experts say there will be more to come. And there could very well be a reoccurrence of this one if we're not careful. So yes, Americans are ready to go back to work, but no, America is not ready to receive them.
I read recently that you are proposing that we have mobile units available for rural sites, even urban centers like here in Washington, D.C. Do you think the Trump administration will embrace your concept of mobile units so that we can have this surge in testing?
I doubt that he will, but we don't need him to embrace the concept, but we need him to sign the bill. I would hope that the Congress, House and Senate will agree on this and will put the money in the next, when we talk about the emergency appropriations that we're now talking about, $250 billion for businesses. We ran out of money yesterday afternoon. I received a call from my banker this morning, who said to me they filed for money today and they said is out. We need more money for corporations and businesses. However, we need more money for small businesses. And until
Yes.
the Senate decide that they are going to let us do what is necessary for mom and pop stores on Main Street, we've got people whose businesses are closed. They never had more than 10 or 12 employees. And what we need to do is take care of them as well. And for us to say we're going to give billions of dollars to Mnuchin to decide who he wants to give it to and not take care of those small businesses on Main Street is unconscionable. But when we do that, and I think we'll come to some agreement to do that, we need to put money in there for mobile units so that we can get out to these remote areas, to these rural communities that I call persistent poverty communities in many instances, because these people are getting on buses coming in to work in what is called essential businesses. These are low-income people. Just read a story this morning down in North Charleston, a lady making $11 an hour. But she has decided that her health care or health situation, the mental care, I should say, more important than what she's going through on that job, because on the job, they were not given masks, they were not given shields. And she has decided that she would go into business herself of making masks. Great story in the Charleston Post and Courier this morning of what people are up against in rural communities.
I totally agree. Congressman, I don't know if you've heard this story, but sometime I continue to be what I call a caseworker for a congressional office. And I received calls yesterday from people worried about their check, their stimulus check. And I've heard that some of the folks who were expecting a check because they had outstanding student debt or credit card debt, that the wages was being garnished by the IRS. Is there something Congress can do to address this little small loophole in the CARES Act that will allow people to get their stimulus check without it being garnished from credit card collectors or student debt collectors?
If that is taking place, I think that's violated with the law. If my memory serves, we had a discussion of this sort of occurrence, the possibilities of this kind of an occurrence. And I think we explicitly dealt with that, that this is not to be subjected to garnishment. I'll have to check on that, but I remember the discussion taking place. I thought that we had handled that to the benefit of those people who would be subjected to it. So if you're telling me that's taking place, we need to take a look at that, and I will today, because we are going to have another meeting of our full caucus via telephone this afternoon. And I'll certainly bring it up at that time, as I'm bringing up today the issue involving mobile units and also involving bankruptcies. One of the things I think is unfair about this, and this really got through the loophole, Chapter 11 bankruptcy allows people who are having trouble with their businesses to reorganize. And if you reorganize it under Chapter 11, and you've got over 300 people, as one of my constituents got over 300 employees and is in Chapter 11, but he's explicitly being denied participation, which means he's now going to have to terminate those 316 people I think he has and close his business when he was operating under his reorganization successfully. That to me is unfair. So I'm going to bring that up again this afternoon as well. So these are two things, if what you are saying bears out, that I'm going to work on today.
25 state attorney generals and the Hawaii Office of Consumer Protection sent a letter to Secretary Mnuchin last week asking him to issue guidance protecting the payments from private debt collectors. So thank you for making sure that this issue get addressed. One other issue that I know you are deeply concerned about, and that is the racial disparities that is taking place currently. As you well know, in the state of South Carolina, a state that is now close to my heart as well, my brother and his family lives there. 41 Black Americans make up 41% of the coronavirus virus cases in South Carolina. They account for more than half of the deaths. How can we restructure our healthcare system to ensure that African Americans, Black Americans are not the victims of this pandemic?
Well, thank you so much for raising an issue, because that allows me to address something that is really gone viral around the country. So let me say, to put your question in the right perspective, African Americans make up only 27% of South Carolina's population. Now, I think if you take into the account, I might give it 28%, but we certainly aren't 41%, and we aren't 51 or 52%. So we are represented about twice as much among the deaths as our presence or in the population. And one of those deaths took place on yesterday is my first cousin. And I believe that this inequity has to be dealt with. So what is it? It is simply this, and you know it so well. You're a native of New Orleans, if my memory serves. New Orleans, what, 25, 30% in Louisiana, the Black presence of maybe 27%, with over 70% of the victims of this virus.
That's right.
When we were debating this issue, many of us knew about these inequities. I've been crying out about them ever since I've been in the Congress. One of the reasons I've been pushing 10, 20, 30, that is putting 10% of all the resources that's being appropriated in any section of the law into those communities where 20% or more of the population's been stuck beneath the poverty level for the last 30 years. Under the Census Bureau, that defines a persistent poverty community. So we know that the lack of health care is very prevalent throughout these communities. We know that education is being, adequate education is being denied to young people in these communities. And this pandemic, I knew, would expose this for the rest of the world that many of us already knew about. So I said when we were debating, this gives us an opportunity to restructure things more into our vision. What is our vision? To make the greatness of this country accessible and affordable for all. That is my vision for America. So I want to see healthcare accessible and affordable for all. I want to see education accessible and affordable for all. And this pandemic has laid bare the notion that we do not have equity in this system. The inequalities of healthcare delivery have been exposed dramatically in this. I don't back away from that. And if my Republican friends want to try to weaponize that, I would say, as you would say, and I know you so well, bring it on.
Bring it on. Congressman, you have also been a great leader with the Affordable Care Act. Several states and over the last couple of weeks have opened up enrollment to those without health care. Is there anything that the Congress can do now to ensure that those Americans who've lost their jobs, as of today, more than 22 million Americans have filed for unemployment, what can we do to assure that they will have health care during this pandemic?
Well, I'm not sure exactly what we can do, but I know what we can attempt to do, and I hope we will get it done. I am in a state, Louisiana, thanks to the last election, gubernatorial election, or not the last, the one before the last one, you all were able to elect a governor who saw the wisdom in expanding Medicaid. We do not have a governor in South Carolina who has come to the conclusion that we ought to expand Medicaid. Now, I know our governor very well. Henry McMaster and I are working together now trying to get these mobile units out into these areas. He is committed to helping us get broadband in these rural communities. But when it comes the healthcare delivery. I have not gotten him to see the necessity in expanding Medicaid into these into these areas where we don't have health care for too many people. So I think it's about 14 or 15 states that have not done that. What I'm proposing is that we in the Congress take the legislation. You may remember way back when we were debating the Affordable Care Act back in the 2009 and 10. We tried to get the Medicaid authority for everybody. And that came up with Senator Nelson from Nebraska, came up with something that became known as the Nebraska Cornhusker Kickback. It was to allow the federal government to pay the full freight for all of those people who would otherwise qualify for Medicaid. I am asking my caucus to take a hard look at that piece of legislation, and maybe it's time for us to go full-fledged and put the money there to have Medicaid coverage for everybody. We certainly need to have the so-called public option, but I think we need to go beyond that as well.
Do you support the president's decision to halt support to the World Health Organization at a critical time that we're facing today? And what impact do you think that will have on the continent of Africa and other places around the globe, Latin America, the Caribbean, that they assist in funding so many other pandemics and crises?
I'm glad you put that perspective on this, because I think that a lot of people tend not to really focus on what the World Health Organization is all about. I don't believe that Barbara Lee's great work with PEPFAR that was supported by President George W. Bush would have been properly addressed were it not for the World Health Organization. And I really believe that those of us in the African American community have as much respect for the continent of Africa as many of my colleagues have for the continent of Europe. And I believe that what the president has done has been to undercut efforts in the continent of Africa, as well as in the African American communities throughout the United States of America. So I would ask people who are feeling good about this president's short-sightedness in doing this, to think about what happens on these continents. Of course, I know what he thinks about them. He referred to them as S-hole countries some time ago. So I know what he thinks about them, but I would ask my colleagues to take a hard look at what this means to our presence around the world. And if we really think about this world that we live in, we need to get along with the rest of the world. We need to get along with those continents, those countries where people of color reside, because they make up more than 2/3 of the inhabitants of this globe.
As you well know, one of the other concerns that many Americans have today is voting this fall. Can you give us any update on assistance that will be given to states and localities to ensure that we can go to a mail-in system or some type of system that will allow ordinary Americans to cast their ballots?
Sure. In the CARES Act, as presently constituted, there's $400 million in there to assist local communities, states, and local communities with doing what is necessary to implement an effective and efficient voting system. Now, we put a requirement in there that these communities had to come up with matching funds. I've asked our caucus to look at removing that requirement so that we can help these communities with direct funding of that $400 million. But in addition to that, we need to add about $1.6 billion to that so that communities will be able to afford to have efficient, effective elections this November. Now, I know that the president has come out against us using mail to vote, though he uses it to cast his vote. He doesn't want anybody else to use the mail to cast their vote. I vote early or absentee every year because I have to work on election day. We need to remove those impediments for people to vote in federal elections. We may not be able to tell the states how to run their elections, but we can tell the states that for federal elections, we are going to have mail-in ballots. We are going to have no-fault early voting. We are going to have people, especially this year, who are over 60 years old, ought to be able to get a ballot in the mail and be able to cast their ballot prior to election day if need be, because they are the ones going to be exposed to the problems, healthcare problems being visited by this pandemic. So we are working hard to get $2 billion appropriated for this purpose. Though Zoe Laughlin has done great work on this, she thinks it may be over $2 billion. But whatever the cost is, we need to have an efficient, effective method of people casting their votes. We did not stop voting for the Civil War. We ought not stop voting for this pandemic war.
One other area that I know you've shown such great leadership is on the U.S. Census. And as you well know, the president also said this week that he will delay the census due to the coronavirus. What are your thoughts on the delay and what implications it will have next year when the states have to begin to calculate the number of states? I have to first say, Congressman, I met you back in 1987, 1988. When I came to South Carolina during that political cycle. And I'll never forget what you told me about the census and how important it was for Black Americans. So what do you think about this delay and what implications it may have on the appropriations, the calculation of districts next year?
Well, I think it has two big impacts, and people tend to miss this. The census is used to determine where people are and to determine their statuses in life. It makes up what communities, tells us what communities need resources and how much. So to me, the primary purpose of a census is to decide where the country needs to invest its resources. So that's how we decide. This thing of persistent poverty communities, that's not a political decision. That didn't come from Jim Clyburn. That came from the Census Bureau. The Census Bureau, by doing its surveys, it determined that there are certain communities in this country where more than 20% of the population has been stuck beneath the poverty level for the last 30 years. And so they have defined those communities as persistent poverty communities. And that's why when we use the census to make those determinations, I'm now saying we ought to spend at least 10% of all the money appropriated in whatever section of the law that it may be appropriated. At least 10% of that money ought to be going into these persistent poverty communities so they can have health care, so they can have online education, so they can have what we call telehealth. That's what the census is all about. Now, secondarily, it counts people. And we want to know where the people are, not just what their status might be, but where they are. And if people are moving, and I don't want my friends up in New York to get upset, but so let me know, I won't mention anyone. If people are moving from one state to another, then it means that less people are in that state that they're leaving and more people in that state where they're going to, and then we use the census to determine what the representation should be. And that's why we're seeing an increase in the number of people down, Congress people coming from Texas, coming from Florida. 10 years ago, there was an increase in people coming to South Carolina. And so we went from 6 Congress people to 7 Congress people in order to have equitable, not equal, but equitable representation in the United States Congress. So the census is very important in order to determine what people's needs are and also determine where people are.
Well, Congressman, I want to thank you for your time, of course, your leadership. Again, as chair of the new select committee, we want to thank you and congratulate you on that role. On behalf of the Gwendolyn and Colbert King Endowed Chair here at Howard University, continue the great work for the people of South Carolina, the people of the United States of America. So thank you for joining us today.
Well, thank you so much for having me, and congratulations on assuming this position. I think you will bring great wisdom and a little levity to it.
Thank you, sir, and God bless you, and God bless your family.
Same to you, my dear.
Thank you.
This program was produced by WHUT, Howard University Television, and made possible by contributions from viewers like you. Thank you.